Hello, so this is a video response to the OB discussion that we're talking about, the 4 obstetric emergencies that we're supposed to discuss. There's cord prolapse, the umbilical cord prolapse, placental abruption, uterine rupture, and amniotic fluid embolism. I made a fancy little chart. I will post that with my discussion. Okay, so cord prolapse, that's when your baby's umbilical cord is coming out of the vagina. The head is not engaged in the pelvis, and so that baby is very high up, and the bag of waters has ruptured, and that cord comes out first. What we're going to notice is bradycardia in the baby, the heart rate, of course. So when we see that sudden bradycardia, that's a big emergency. That's why we're constantly watching those monitors to make sure that that kind of stuff doesn't happen. Some of the risk factors would be when the baby has more room. So like for preterm babies or preterm pregnancies, baby's coming too early, the bag of water ruptured, and now the cord is coming out. Some interventions we want to do right away. Make sure that that pressure is off the umbilical cord. So you're going to have a sterile glove on. You're going to insert your hand into mom and push that baby's head away from that cord. The longer there's the cord compression, the bigger risk of any hypoxic events and things like that for baby. You don't want to cut off that oxygen supply because you can have long-term damage for the baby very quickly. So we want to avoid that if all possible. Other interventions we're going to do is we're going to have mom turn one side to the other. We are going to put her in Trendelenburg, like where her legs are up. We're going to give her some oxygen, and we're going to prepare for a C-section. So we're going to be calling surgery, we're going to be calling anesthesia, we're going to be calling NICU in a preterm birth or the obstetrical emergency that we're facing. You're also going to want to give some emotional support to mom and to any supporting partners in the room because it's going to get crazy really fast. All emergencies are kind of all hands on deck, and so you want to get mom and baby safe and delivered as quickly as possible for the best possible outcome for both mom and baby. You're also going to watch for some hemorrhaging and things like that after, especially in an emergency situation. So that's the umbilical cord prolapse. The next is the placental abruption. So normally the placenta is nice and attached to the uterine wall, having a good blood supply, carrying nutrients, and getting rid of waste for baby. When we have a placental abruption, we're going to have blood behind that placenta. So we don't want that. It's the risk factors and things where you're going to notice some vaginal bleeding in mom. We're going to notice it could be some severe abdominal pain, cramping. You know, mom is alerting us to, hey, something's going on. Lots of bleeding and very uncomfortable. We're going to assess them, going to assess mom and see kind of what's going on. We can do like a ultrasound to make sure everything's okay. Then we could see the placental abruption. If it's something severe where it's coming apart from that uterine wall very quickly, we're going to go into an emergency C-section because we don't want baby losing blood, just like in the other example with the umbilical cord prolapse. Once that cord is compressed or any damage to that placenta is occurring, it's an emergency situation for baby. And it's also going to be blood loss for mom should things progress. We don't want fatal outcomes or fetal demise in pregnancies. So we're going to, let's see what else. We're going to be watching those monitors again. We're going to check for signs of fetal distress and make sure that we're just staying on top of it so baby, again, has the best outcome. So the next one is going to be our uterine rupture, and that is when the uterus is tearing. So it can be tearing from a previous scar. If the mom had had fibroids and they had gone in and cleaned her out, it could be from a previous C-section. There's many different causes depending on the past medical history for mom, any past surgeries of the uterus, or any lower abdominal surgeries that mom may have had. She could have had, molar pregnancies, or she could have had ectopic pregnancies, and they've had to go in there before. So it's going to be weaker on that scar tissue. It's not going to be as strong as our existing uterine lining. So that is a risk, the uterine rupture. I guess that used to be common when people would opt for VBACs, the vaginal birth after cesarean section. And that is said to not be something that doctors or healthcare providers will even allow anymore because it's such a big risk. You don't want any of the fatalities. You don't want, the malpractice insurance to rise. You don't want, any patients to be put at risk. You want them safe and delivered, and everybody to go home happy and healthy. So there's no real specific treatment for the uterine rupture. You're going to make sure that baby is getting oxygen. Mom looks good on the monitor. Baby looks good on the monitor. And we're going to keep her safe. We want to get baby delivered and everybody out safe, and watch those monitors again to make sure that nothing else is going on. The signs and symptoms for that is going to be when mom or baby goes hypoxic, hypotension. Let's see. It could be, we could have a uterine rupture because of a fetal demise. Say we had a stillborn baby in there, or, for whatever reason, there was a demise before birth. And so there's all kinds of factors that can play into that, but we, again, want to watch. We want to watch mom and baby. We want to make sure everybody stays safe. So keeping an eye on those monitors, making sure that blood pressures look good for both mom and baby. Baby looks happy on the monitors, are all going to give us better indication that things are going well. The last one is going to be the amniotic fluid embolism. So that is going to be, let's see. So it's when debris is entering mom's circulatory system. So it's going to be causing respiratory distress because it's crossing that barrier and now it's affecting mom. What we're going to want to do is watch for signs and symptoms, of course. We want to make sure that there's no hypotension on this one. We're going to watch for, respiratory distress, altered mental status, making sure mom is coherent and knows what's going on. Anytime we go off baseline or mom just, we had a good baseline, we did our head to toe assessment, we know how mom is, what mom's normal is at that point. Once we're noticing any changes, that's got to be a red flag to address. So we're going to be giving life-saving measures at that point. We're going to be intubating mom, most likely because we're having those respiratory issues. We're going to be giving blood, plasma. We're going to be managing the DIC. So this can happen from uterine trauma. If mom fell, if mom had a car accident, that kind of thing, that can cause this amniotic fluid embolism. Many different factors. That's why we always got to pay attention and see, what that baseline and what it's not, or when mom comes in and she's already in one of these emergency situations, we have to do our assessments and make sure that everybody's healthy and make sure that, there's no interventions that need our immediate attention to have a safe outcome. So we're going to, with the fluid embolism, we want to, of course, do seizure precautions because we have the change in mental status, we have respiratory distress, we have lots of factors going on. So we want to make sure that we're keeping an eye on the vital signs. So yeah, let me just make sure I didn't miss anything. Okay. Yep. So fetal demise, we're going to see in the amniotic fluid embolism. The uterine rupture, again, is from scarring or history of previous uterine surgeries, C-sections, that kind of thing. With the uterine rupture, we're going to do an emergency C-section to get that baby out. With the fluid embolism, most likely baby has already passed. So we're making sure that mom is okay. So all big scary things that are happening, but again, watching monitors and watching mom and baby to give our best outcomes in any situation that's presenting is going to be our best bet. So again, those were cord prolapse, placental abruption, uterine rupture, and amniotic fluid embolism. Thank you.